healthcare needs to change. You'd be hard-pressed to find many Americans who would disagree on that. As an ongoing point of contention in the recent 2 decades of election cycles, many people say the system is broken. I'm simply paying too much, and it's better to wait for myself to get better than risk a stay at the ER, lest it break the bank. As a typical American, I knew healthcare was broken. But if asked exactly what was wrong, I would say medication is too high. People shouldn't want to go to another country to have affordable surgery or even dental work, but that's just scratching the surface though. It's a lot more broken than you realize. We are vastly overpaying for medication. A study done by the committee staff of the U.S. House of Representatives found that in 2016 alone, over $450 billion was spent on retail and non-retail medications. A staggering number, even more so when you see that Americans were paying 3.7 times more for medication than our European counterparts. Looking at the table, you can see that in 2018, the U.S. had on average of $466 in drug price when comparing 79 drugs. The UK saw an average of $105, Canada $132, Australia $113, Japan $69, all measuring medications that are equivalent. Looking at the drug list, you can see that other countries didn't have all 79 medications being tested. Remember that because it will come up later. But for now, looking at the list, lower priced drugs saw the most disparity. Dulera's American price point, $23 per dose, versus an average of 49 cents in other countries, 5,000 times higher. Premarin, 3,000 times higher. Advair Diskus, 1,296 times higher. Humira, on the other hand, would end up costing $2,346 per dose, where in other countries it was on average $450 per dose. The closest was Denmark, with $787 per dose. Feel gross yet? How do they get those price points, though? Well, it goes through a very simple process of research and development, manufacture, negotiation with prices with board, negotiation between insurance companies, negotiation of price with pharmacy benefit managers, middlemen between pharmacy and manufacturers, and then to clinics, hospitals, and you. And they negotiate at 3.7 times the prices of European contemporaries. Lots of hands and a lot of money passing between them before they get to those that need it. Dreaded Big Pharma at it again, reaping profits as high as $8 trillion. The ER is, for the most part, a scary place to be. Though after being there enough evenings for my job, I can say that some people find it exciting. I digress. For most normal people, being in the ER can be the worst moment of your life. It seems now, though, that the L you took trying to backflip off the back of a truck to impress your crush is going to cost a lot more than going on Tinder and watching a how to get a girl video on YouTube. An ambulance ride from your unfortunate display of bravado, if done in 2016, would have cost you an average of $1,042. But it would cost you $1,277 as of 2020. A 20% price hike up. If you managed not to break your leg and needed basic life-saving services, it'd be $800 then and $940 now. All as of a study done by nonprofit Fairlife in 2022. There's been a trend of rising ER costs as evidenced by a study done using the National Emergency Department sample. In the time from 2006 to 2016, spending jumped from $79 billion to $136 billion. The average visit jumping from $660 to $943. It's not just a cute sudden shock from poor choices, though. It would also come from a grandmother who, because of her arthritis, doesn't walk as much, weakening her muscles, weakening her body, and as a result, falling down the stairs. A methodical series of events that lead to hospitalizations. A truth that our current perspective on healthcare is not designed to solve. Chronic disease. The CDC reports that 6 in 10 Americans suffer from chronic disease, which are largely due to our cultural track record of drug use and unhealthy eating habits, which I don't intend on changing your minds on today. God bless America. In our current pay-for-treatment model, that is, we pay when we need to go to the hospital, surgery, a checkup that results in staying under observation, being hospitalized for an exam of chronic disease, means that our chronic conditions are only being treated symptomatically, surface level, and not targeting the heart of the issue. And in instances where they do it is at a higher cost as the issues weren't noted or addressed earlier. rising medical bills with no clear end in sight, a cycle of losing money to sudden body failure or rupture. Thank God for insurance. Money, money, money. That is the main contention for a healthier America. These services are necessary, which means that there will always be a market for the industry. For a low to low middle class family already living in unhealthier conditions, compacted with higher medical bills, they find themselves stuck to not being able to provide themselves the opportunity to spend on anything else other than medication. This is perpetual suffering, a cycle that can be broken by reducing how much a person can spend on medication. Punish Big Pharma. But I don't mean that in the sense of deliberately making it hard for them to make money through taxation, but installing price caps, incentivizing keeping up with the rest of the world. The main defense from Big Pharma is that stifling their profits would drastically hinder innovation, life-saving treatments, that, quote, the solutions put forward today are anything but. They're just a step backward. They could propel us light years back into the dark ages of biomedical research. From Dr. Michelle McMurray Heath, President and CEO of the Biotechnology Innovation Organization. But that's not necessarily the case. These independent companies are not solely responsible to strides in research. A paper published in the Harvard Business Review wrote that pharma's advancements were superficial, rebrandings of already existing products, small differences, and in an industry that purports funneling more into R&D than its contemporaries, perhaps that funding is misplaced or mishandled. When the federally funded National Institute of Health can actually make worthwhile innovations, you would have to think that the industry is more drawn to making money than furthering developments of more therapies. Costs unjustifiable. Taxpayer money has already seen $900 billion being put into this program, with an astonishing 210 new drugs being approved when studied in 2018. That's innovation that excites. Sanctions, incentives, and higher allocation of funds into nationally invested programs match European prices or make the discrepancy drastically smaller. Take hands out of the cookie jar and make a more worthwhile investment. Instead of having market prices be 3.7 times our contemporaries, match them. In the American industry that has seen a gross profit of $8 trillion between 2000 to 2018, there is no reason to not push back on an industry that is reaping more money than a man can spend in his lifetime. Give me my insulin. Hospitals need a reframe. From the fee-for-service model to preventatives. What will keep the people out of the hospital for longer instead of how can we stop people from dying now? This would involve more at-home care. Higher emphasis on travel nurses that would go to their patient homes and give them what they need. This would go for the most at-risk patients for their chronic issues. Most Americans already live with chronic conditions. This strategy would bring the hospital to the people and save them from more expensive procedures later. The best way to keep costs down and low would be simply to keep people out of the hospital for longer. Data gathering on more ways to streamline care as well. Nurses. Always the most undervalued class in healthcare. According to a paper published in the American Journal of Medicine, nurses will spend 84% of the time of a patient's stay in a hospital with them. This is a source of a lot of knowledge on ways to cheapen costs, show what is necessary, keep the hospital grounded onto one-on-one experiences. More nurses in more areas of executive control would bring all that experience to the forefront. Programs that would allow nurses into points of transition into higher corporate positions would mean allowing that experience to be used in an environment that would enable the most possible change. Going back, when you fumbled the bag earlier in your accident, now with the decreased pressure from chronic issues coming to the surface, your ambulance ride will be less expensive as demand for ambulances will go down. These are solutions for two aspects of healthcare, without attempting to touch the mess that is insurance. It is a hope, though, that stemming issues at the core instead of symptomatic problems would alleviate a healthcare system that is being crippled under its own weight. The healthcare system is chronically diseased. Where's the preventative care?